All right, we're starting over because I was muted. We're back. The media debate, the panel I was looking forward to the most today. I was told to host this like a Jerry Springer episode, Team A, Team B. I was thinking more like the Love is Blind reunion, and I am the host, the Lachey's. So, take it for what you will. Over here on my left, I have Team A. We've got Evan and Alex. Over here on my right, we've got Rich and Brandon, and we're going to be battling some of the hottest topics in media. So what's really interesting is when we're working with clients or prospective clients, we're always analyzing a set of circumstances to decide if something is the right or wrong choice for their business. We never really get to just take a firm stance. So we've given these guys some prompts, and we're going to be asking them to debate one side or the other. At the end, I'm going to give away some prizes. So I expect, let's see, I'll probably be grading it on accuracy, passion for the topic, and let's see, give me some real examples too, guys. All right, let's get started. So topic number one for the day, and this is something I think is probably one of the core questions that you start when you might be starting a paid search initiative for your business, is brand. So what I'm going to ask team one over here is it worth bidding on branded keywords? So I'm going to ask you guys to take the position of no, you should not be bidding on branded keywords, and for you guys to take the position of yes, you should always have branded keywords on in your campaign. I'm going to let the kind of no position go first. Love to hear your guys' argument. Why would you not want to use branded terms in your paid search campaign?
Sure. This is an easy one. Of course, you should never pay for branded keywords with healthcare, because invariably in every client and every business that we work with, everyone is looking for primarily new patients, almost exclusively for their marketing dollars. They're trying to spend money to acquire net new patients, right? And we know that branded keyword traffic almost exclusively brings in people looking for directions to your business or existing patients to call back and visit their doctor. So we would argue that it's kind of wasted money. Organic and direct traffic typically picks up on all this traffic anyways. And it's not worth it because we end up just acquiring more existing patient leads, and it's a waste of money.
All right, so the team in favor, I'm going to give you guys a chance to respond on why you think it should be included, and then I'll give you guys kind of the final rebuttal.
I mean, first of all, absolute poppycock from Team A. Clearly have no idea what they're talking about. Brand is an absolute mainstay of any keyword coverage plan in healthcare. And while I understand the concerns of my right honorable friend that we may be seeking existing patients by leveraging brand terms, that can easily be solved for by leveraging the right conversion signals. So if we are able to track new patient bookings, new patient leads, we can have a great brand strategy where we can be visible on brand. We can ensure that we're not getting conquested by competitors, those sneaky competitors who will come in on our brand terms and try and steal our traffic from right underneath our noses. And we can control much more effectively the user experience that traffic goes to, that is built for conversion, as opposed to an SEO location page, which is where they might also go to, or a home page where there's all these different options and all these different pages that they have to go through to get to that end conversion. Brand is absolutely a mainstay of any good PPC keyword strategy, and I will never change my mind on it. Never ever.
A firm stance indeed. I'm going to see if Alex has anything to add to that argument for the no side.
Yeah, I'll push back on that and say, I think like with branded search, most websites are going to have a well-established SEO program enough to rank for their own brand name. So whether it's a new patient or an existing patient, I think the point still remains is, can organic still pick that up when they're ranking first for their brand name? So that would be my pushback, is if you're ranking for organically for your brand name, which most websites should be, then it feels like branded search is just, you're paying for what you could be getting for free.
Anything to add, Brandon? Final thoughts?
Yeah, it's an easy response. SEO alone can't handle all of that you can pick up from a paid perspective for branded terms. So you lose too much control. You can't drive exactly the experience you want. And that's not something we should sacrifice.
So it's my job here, if your brand resonates with perhaps the statement that these guys are making over here, my organic is really strong, I don't need to, you can lean heavily in this direction. You can kind of test turning brand off and seeing if you pick it up. We did a session yesterday on cannibalization of paid and organic, but if you're kind of in this camp, you say, I'm spending a lot of money to build my brand. I've got a full funnel strategy. Why would I not be there to get the cheapest conversions possible? This camp also makes sense. So I think good debate there. I think as with all things, there's going to be a time and place for either use case, but I love the firm stances. That was the easy one. We're going to get into some that are a little bit trickier. And I'm going to start with Alex on this one because I know he's passionate about this topic and we've done a podcast episode together on it. So let's talk about PMAX. Is PMAX worth the investment? You guys are going to take the affirmative, the yes, you should do it, and you guys are going to make the argument for why not to do PMAX. So Alex, you're up.
Yeah, so I would say I'm in support of PMAX versus a search only strategy because it, first of all, introduces new channels to the mix to where you can actually see what is the incremental, like versus just your next lead on search. You're able to see what is the cost of the next lead on all these different various channels. So I think it's an easy step in the direction of diversifying your channel mix when you have good conversion, kind of good conversion signals in your account. And I think it's good, again, because you're in the Google ecosystem, it's just a natural evolution of your search campaigns before you kind of maybe go off into other platforms.
I'm sure you guys have some arguments against that. Brandon, I'll start with you.
We do. Yeah, I want to talk about what is PMAX in the first place, right? And so it's this opportunity to go into all of these other ad types, these other placements, reach a lot more places that you can't get in search alone. But the problem is it's also about huge audience expansion. It only uses signals that we put in. And honestly, that's just not truly appropriate for healthcare in the same way that it is for other industries. It might be great to bring in as many people as possible for something like the e-com industry. But when we're talking about healthcare and the fact that there's a black box in many cases around the data that we can get to and see, we don't understand what's driving it. And so what happens is when you're talking about lead campaigns and that nature of things, you end up driving lower quality, incredibly higher cost because you just can't get down to the intent that comes along with search. So you're much better positioned to focus heavily on search.
I know you guys have an argument against this. Let's hear it.
First of all, how dare you, sir? No, I would just say that you're right. I think, PMAX is a bit of a black box, but it's firing cheaply with a shotgun. Basically, you're getting tons and tons and tons of impressions and cheap clicks and traffic. And ultimately, while the conversion rate we see tends to be a bit lower than search, the cost offsets that and often drives a lot of high volume, easy to deploy campaigns that will drive these conversions at an efficient rate for you. So especially leveraging deeper conversion signals, we see it as a huge win and as part of what Google is pushing. If you want to be on the cutting edge of what Google's machine learning and algorithms and inventory is offering, Performance Max is absolutely one of those things.
Rich, final thoughts?
P-min, more like. I mean, I think, again, it's one of these things where you're completely handing over the controls to Google. And then who's watching it? Who's making sure that the machine is not running amok, right?
Google.
Yeah.
We can trust them.
Google is very good at driving what you tell it to drive. I think a lot of companies have the issue where they do not have the deepest possible conversion signals, or where Performance Max cannot drive enough of those deep signals to make it worthwhile running. And so what ends up happening is you have an algorithmically driven campaign running amok, getting you all the calls from ads that anybody in your area could possibly find. So if you like getting solicitation calls from random vendors, PMAX is for you.
We all know Google would never waste your money, right?
Of course not. Of course not.
They are all in it for efficiency. Look, I'm forcing these guys to take sides so we can have a healthy debate and really see both sides of the coin and where an organization might fall. But at the end of the day, this argument for is a yes if you have the right signals so that you're optimizing towards the right things. These guys' argument on this side is absolutely fair because, like you mentioned, Brandon, in healthcare, unfortunately, the signals are oftentimes shallow And if they are shallow, it might not be the recommendation that's coming to the top of your strategic roadmap. So work on getting the signals and the data first, and then think about evolving into PMAX. But it's, as Evan mentioned, it is the cusp. It is where Google is going. If you want to adopt their products before they deprecate the ones you're used to using, you probably should be at least thinking about testing it. All right, let's dive into topic number 3. And this one's going to get a little bit more granular than a yes, no. So we debate this internally all the time and with our clients. Should you use, let's talk budgeting best practices. Should you use shared budgets? Should you group your locations together? Should you bid in a single campaign for all non-brand keywords? Or should you use super granular location-based budgets? So I'm going to give you guys each a stance on this. Team 1 over here, I'm going to have you guys take the position of you must use granular location or service level budgets at the campaign level. And over here, I want you guys to argue the point for using some sort of shared budget or grouping methodology. And I've been starting on team 1, so let's go ahead and kick it off with team 2. Rich, I'm going to ask you to make the argument for shared budgets.
Sure. So I think when you think about an effective budget strategy, you're thinking about 2 things. You're thinking about operational efficiency, and you're thinking about performance. And if you run a multi-location healthcare platform that has 200, 300, 400 plus locations, trying to manage budgets at the individual location level is not only incredibly time consuming, but typically, especially if you're optimizing towards deeper conversion signals, most of those campaigns do not have a ton of conversion volume. So Google cannot be as effective as it would be if you did have more conversion, if you had essentially more conversion volume for the algorithm to optimize against. So our recommendation, die hard as it is that you have shared budgets because you can group locations together by need. So usually what we will do is we'll go to a client and we'll have a kind of a 9-box design or a tiered solution where we say, okay, you've got 400 locations. Let's break this up. You've got 100 locations that are high need, high digital efficiency. Let's group those together and let them have a shared budget. We'll fund those the most. We have another 100 locations that are high need, low digital efficiency. We'll group those together. They'll get their own separate budget. And Google will distribute the dollars amongst those locations because they all perform roughly at the same level. Then you've got a low need, low performance, and a low need, high performance as well. So you've got these groupings that are A, much more manageable, but B, don't have this issue, which I'm sure my right honorable friends are going to flag, of Google just spending all the dollars on a few of the locations because you're grouping them by performance. So because there isn't a massive performance difference, Google is much more likely to spread the love evenly.
All right, let's hear it, Evan.
That was a lot of words to explain how lazy you are. I would say, look, the highest level strategy ultimately and the best efficiency you can drive for a business is to have absolute control over locations and service lines. And that's the only way. If you use shared budgets, you lose that control almost entirely. You can't tell the system exactly, well, this location needs to be prioritized over this one because it's treating them all the same. So having that granular control, when we talk about the future state of a business, is understanding the efficiency of each location, right? How efficient are these, the call center, the people working there at converting leads, right? And what about service lines, right? They all likely drive different amounts of levels of revenue. We should prioritize them differently and budget against those differently to deliver an end result that is the most efficient delivery of revenue for the business. And you can't do that if you're sharing budgets.
Brandon?
Look, Evan, we know you like to just spend all your time in the budgets all day.
Yes.
But the real
Budget sheet
truth
king
is-
over here.
He is. We leverage him that way a lot.
Best paid media in some we have.
So
Yes.
the point is, you're going to spend all of your time doing nothing but budgeting. There's a lot of other layers that are really important in how we strategize around these campaigns and develop the results that we need to drive. And if you're going to spend all your time managing individual location budgets, and you're going to feel smart, right? But you're really not doing a whole lot other than shuffling these resources around. What really needs to happen is you need to understand, just like Rich shared, what is the real need across these groupings of locations? put that into place in a way that's effective, and then be able to focus your real energy on the strategy for everything else that's involved in a campaign, budget being one small piece.
Alex, final words here?
Yeah, I mean, I
I've seen you
think
build some pretty sexy budget sheets.
I think to go back to Rich's ludicrous idea that he threw out there about grouping campaigns, I think you still run the risk that any individual location within that group gets served disproportionately relative to what maybe we think it should. So I think this the concept of shared budgets innately has it's just problematic sometimes depending on how much variation you have across your location mix of like the high need versus a low need and the high performance versus low performance.
Clearly, you were just doing it wrong.
At the end of the day, look, we have client with 900 locations. I think Brandon's point of spending so much time budgeting and pacing 900 plus campaigns is valid. And, you know, the ability of kind of the 9-box strategy to help with some efficiencies is also valid. The steerage is a real problem for a lot of our clients. They are having trouble getting cannibalization of certain clinics over others, especially when they're in similar circumstances. And they're finding that their patients are leaking out of their system because they simply can't find an appointment available in a relative geographic area that's convenient for them. So we don't want either of those things to happen. You know, a lot of where we've moved to today is hybrid structures. So you've got certain instances even within the same client account where you're using some shared groupings, but maybe your high needs are all individual, and you're moving them on a monthly basis depending on how their circumstances change. So definitely time and place for everything. I appreciate the humor here. Let's keep it up. I think we're 3 questions in and maybe 3 to go. So I'm gonna call a win on the humor side on team 1 thus far. I think
Of course.
Favoritism.
But you guys have a chance to bring it back. All right, come on, let's bring the heat in our next question. So what is the best time to introduce paid social into your media mix? We did a whole panel this morning on how some of our partners and non-partners, businesses, health systems to multi-site provider groups are using social. I want from y'all's perspective, the real people behind the computers, to give me your point of view. So team 1, I want to hear you guys, you know, kind of make the argument for it's not time for social, why you might not want to introduce it. And over here, I want to hear you guys talk about introducing social right away, right? Getting right to it. It's a must-have for every client all the time. And I'm going to bounce back to you guys to take the first stab at this one. So this is the social should wait, and there are other things to accomplish first.
Yeah, so I'll start here. So I'd say, kind of going back to the point about Performance Max, it's likely that you haven't maxed out your search impression share loss to budget on search. And even if you haven't kind of expanded into PMAX yet, then you know that's another avenue that you still haven't explored. So those 2 are both things that I think you need to be checking off the box before you get into an entirely new platform where tracking those same actions that you were tracking in Google is going to be a whole kind of thing on its own. And in terms of just search and PMAX, I think there's a time and place for social, like as we're saying, but in terms of maximizing your ROI and with the budget, the kind of the returns with the budget you have, it seems to me like search/PMAX as you maximize search is the right way to go versus potentially throwing another channel in the mix and not really knowing how to measure it up against a channel that you've already ran, which is search.
So Alex, I'm hearing and I love it, dollars in, results out type of approach, right? Let's walk our way through that. What do you guys have to say about that?
Sounds to me like you're completely flipping your stance here after wanting to
Did
invest
I
in
pick the wrong
PMAX.
sides?
But I think we can tell from the earlier session today how much importance social has, right? There's a lot of interest in it, and it's kind of frankly ridiculous to avoid it. We recognize that social and search are different things, and they're not going to drive the exact kind of thing, right? Search is very intent-based, but social is very much about driving brand affinity, engagement, broader awareness, and it can drive those leads directly. So there's a lot of opportunity and a lot more of a dynamic opportunity with social that frankly is just not a good idea to avoid or wait too long. We've seen so many examples of that where there's this fear to take that leap into social because, okay, we understand search, we've got this, but you're really missing starting with that if you have to have a perfect attribution setup or other reporting, because it's not just about those metrics. Ultimately, it's about the much bigger picture, and social is a critical piece of that.
Evan?
I would agree if you're interested in getting terrible results. I would just argue that, you know, when people are spinning up digital marketing, the initial need is invariably about getting traction on driving leads and patients. The most direct route to that is to capture people asking for your services, which is paid search. It's the highest intent platform that exists. And most of the time, you know, it's most important to dial in your tracking and attribution before you start throwing other money elsewhere if you can't tell what that money is doing for you, right? So let's take search. Let's focus in on the thing that's the clearest, easiest to track, refine our approach, make sure that we understand the results and the efficiency that's being driven, and then we can step into social and tackle that project secondarily. But certainly naive to try to do it all at once and cross your fingers.
Rich, the king of MMM, I know you're going to have an argument to that measurement piece right there. Let's hear it.
Firstly, I don't think our clients should suffer because Alex Kemp doesn't want to switch his browser tab to a different user interface to help run campaigns on it. Oh, let's just do Performance Max. It's all in the same platform. You're really, you know, a trusted advisor. I think social has a myriad of benefits, right? You know what I love to do? I love to get healthcare from a random healthcare provider that I've never heard of before. No, I like to understand, I like to have brand awareness. I like to have engaged at an emotive level with social content about that provider and really understand in a deep way how that provider is going to help me on my healthcare journey. I can't get that from a paid search ad, guys. I can't. Also on social, I can target claims-based audiences. I can target people who have the right diagnosis, who've had the right procedure, who are taking the right medication, right? I think we all know that there's been so many instances on a just search only campaign where there hasn't been enough demand to support the budget to help meet the capacity needs of a provider group, or where the same keyword could deliver an incredible lead or a terrible lead, depending on what insurance that person has or where they are on their patient journey, but they all type in the same thing. As for measurement, don't even get me started. Media mix modeling, if you guys had the best 20 minutes of your morning earlier, you would have also engaged in my session on that. So I think there's all different ways that we can get around the preposterous excuses made by Team E for erroneous, and that we should just, you know, get social up straight away. Wouldn't you agree, sir?
I agree. We'll be leaving you behind while you're waiting.
Yeah.
Disaster.
Here's
Enjoy your
the thing
one
I'll
channel
say,
strategy.
as the one always advising alongside these guys when we get a new client coming in the door. Social is probably not the thing you're going to stand up on day one when you launch your paid search campaign and the first time you ever, you know, make an optimization to the back end of your website or your Google My Business listings. But too many times we are coming in to these organizations that are spending 6 figures plus on paid search, and their field is telling them on a daily basis, I need more, I need more, I need more at this clinic, and we have nowhere else to go. Do not let yourself get to the point where you have maxed out a channel and only then are you saying, I should probably test into something else, right? Get it off the ground and then start your testing, let your evergreen run, continue to optimize it, but do not just rest on those laurels, especially with the way Google is changing. I love the recommendation of PMAX as kind of part of this bigger picture as well. So good arguments there. I like those. You know, it falls somewhere in the middle. And I think the other thing I should call out, Evan, you made a point of this, resources. Internal marketing teams are small at healthcare organizations. It's not always the largest team. And you do have to identify what is kind of, you know, from an ICE methodology standpoint, going to have the biggest impact today, maybe this week, maybe this month. And social might not always fall on that list. But don't, you know, put it on the roadmap for somewhere down the line. Okay. moving into a bit of a debate on bid strategies. So those of you who are in the weeds with your agency or in the weeds in platform, you're hearing conversations about, oh, you're manually running your CPCs, or you guys are maximizing for conversions, but there's no target on the CPA. Rich, I know, is a big fan of, and I'm going to put him on the opposite side of this debate because I want to make him suffer, of kind of a value-based bidding strategy. So let's divide this up. We're going to make you guys make an argument for one of the kind of bid strategies available within the Google Ads platform. Team one, I want you guys to talk to me about why kind of target CPA or target ROAS is the approach. So kind of having like a target on your efficiency. And over here, I want to hear you guys talk about kind of the volume approach. So whether that's maximizing your conversions or maximizing some sort of activity without necessarily trying to control for efficiency. Let's go ahead and kick it off with you, Rich.
Yeah, I think for Brandon and myself, we've always been big believers from an early age in max conversions, because
Since you were born.
Since we were born, since Google released it. Because essentially, you know, if you think about most of the things that an organization is trying to achieve, they are trying to drive a certain number of new patient acquisition or new patients or new patient leads with the usual limiting factor, which is the budget, right? You have a certain amount of dollars in which you are trying to drive a certain amount of lead volume. And obviously the answer is always, when people say, how much volume do you want to drive? The answer is always the most possible, right? It's not nuanced. Right? I have $10,000. I want the maximum amount of conversions I can get for that $10,000. What I don't want is to be choked out in my budget, not being able to spend because I put an artificially low target CPA on based on limited amounts of information, based on wonky conversion signals, right? I want to get the most bang for my buck. And what Google will do when you set max conversions is it will deliver the most volume of conversions out there for your budget. And especially as my right honorable friends over here seem to be so interested in location level budgets, it will allow you to achieve the max volume for individual locations segmented by, 400, 500, 600 locations. Are you telling me that if you have 600 different campaigns and you're running target CPA, you're going to go in and you're going to be tweaking the target CPA on all of them?
You calling me
Did you
lazy
just come
about
from another country?
Yeah, I'll see you in 2027 when you're finished.
All right, Peaky Blinder, let's go ahead and hear, let's hear this argument over here on target CPA, controlling the efficiency.
Yeah, I'd just say I'm comforted to see that the dynamic has stayed the same and that lazy versus effective is proceeding through this debate, which is to say that, of course, we want to have control over the performance threshold that we're delivering, right? They're talking about letting the system just broadly drive whatever they see fit and spend your money, even if it's not meeting your performance efficiency needs. And we absolutely oppose that. We would say target CPA, if you just have one set of conversion actions that you're trying to drive, let's tell the system this is how much we're willing to pay for a conversion action. If it can't deliver that, then it will slowly stop spending as much. And that's a good indicator that you should work on other things to improve your campaign, expand your keyword universe to drive that volume you need. But all along, you're ensuring that you're delivering the right performance that you need for the service line and the business. Same is true for target ROAS, right? Either you're applying different values to different types of leads, whether it's calls and forms, and they behave differently, or different service lines using value-based bidding. We still want to tell the system this is what we're going to be tolerating in terms of performance, and make sure that it delivers that for us.
Brandon, can you stomach that? Can you stomach a campaign going dark because it didn't hit its efficiency target?
Absolutely not. No, let's be clear here. The dynamic is actually scared and conservative versus really trying to drive and maximize results on this side here. So what did we go back to earlier? I know Rich talked about it. He said the real goal here is to drive revenue, and we need to maximize what we can do there. We already talked about how budgets are managed, and you said you're going to drive them at the individual location or campaign level. This is exactly the kind of thing that works together well with maximizing the numbers of conversions. This isn't a set and forget thing, but it is a drive every result we can get with the available dollars.
I mean, excellence requires sacrifice, and it's clear to see that you're not willing.
Alex, I know you've got a point of view here.
Yeah, I mean, I think the most problematic thing about max conversions is that by its name itself, like you could have a $10,000 budget, it could get you one conversion, and it technically maximize your conversions with your budget.
That could be the best conversion you've ever had.
It could be, but
Great conversion.
I don't know if I can stomach too many $10,000 CPAs. So I think that's the issue, is that do you really want to spend $10,000 for that one conversion? Now that's an extreme case, but do you really want to spend $10,000 for that one conversion, or would you rather spend $300 and realize, okay, this is much more expensive than I thought it might be before I go, burn more budget?
I think the reality of the situation here at the end of the day, that these guys would all agree, is you're most likely going to evolve through these different bid strategies. You might start with max conversions to get a grasp on how much could I possibly drive, get your volume up, and then start working your way on whittling out the efficiency of those conversions, diversifying your mix. I think oftentimes we see a lot of accounts where there's not one answer. There's locations, campaigns that might be on a max conversion, and then a region campaign that might be using a target CPA. So time and place for these. I think the question at the end of the day is always, what are you trying to accomplish? Where do you sit on this efficiency and volume scale? And every organization tends to be somewhere on that sliding scale, and that'll help us best answer that question for you. So if you're not asking that question, or your partner's not asking you that question, start there. Don't start with which bid strategy is the best one just because someone thinks it is. All right, let's get into our next question. Testing broad match. This is, I think, a contentious one. I think we debate our clients a lot on this one too. There's been a lot of testing in this world, this kind of skating to where Google's puck is going type of mentality. So team one, I want to hear your argument for why broad match is not the best approach. And team two, I'm going to start with you. I want you guys to make the argument for, let's try broad match out.
Well, it's obvious. Of course, we should be using broad match. Some important data here to back this up. Google shows that 15% of all searches are completely new and unique. And they have trillions of searches. So it's not humanly possible for an individual to keep up with the new opportunity of queries that are happening across the whole Google ecosystem. So if we're going to be able to expand, bring in all possible opportunities, we have to be going into broad match. Not only that, but broad match is helping to hunt, right, and find what those opportunities are and what they look like. And so we're not suggesting that we go all broad match, because I know that's the argument that you're going to make, right, is that you're going to get some irrelevant results. Well, that's not the purpose here. The purpose of broad match is really to be able to cover all of those opportunities that we otherwise wouldn't get to and ingest those into our campaigns, and including anything that's irrelevant. You can do that, and you have to be doing it.
Team one, I know you're going to say something about how what happens to quality.
So
yeah,
lazy.
let's hear
This
it.
continues
Give it
here.
to them.
Broad match keywords are preposterous. You put a keyword in, let's say we've seen it ourselves. If you're trying to target people asking for a primary care doctor near me, it's capturing searches for gastroenterologist in Texas. Whoops, that's not what we're asking for, right? And we see that time and time again, right? So this is broad match. Google makes a lot of promises. It doesn't deliver uniformly on the use of broad match, in that, in fact, it requires more time to go in and provide an unbelievably structured negative keyword framework to prevent this tool from going haywire and driving wildly irrelevant traffic. And ultimately, it doesn't convert. So yes, it's going to spend your money. It's going to drive a lot of clicks, but it's going to drive a lot of confused people to your website that are not asking for what you offer.
Rich, any ideas on how to control that?
Scared again.
Well, I mean, clearly, I mean, obviously, Evan and Kat would rather just sit up all night with their thesaurus looking up synonyms to add to their keyword campaigns.
Yes, every night I do that.
Again, scared of where the future is going. I think we all know that Google is leaning more and more into broad match. Broad match keywords have access to additional signals that phrase and exact match do not, because they were so 2020, guys. You know, previous searches, using the landing page as a filter to improve traffic quality. There's a whole lot of additional mechanisms that Google is building around broad match to make that more effective and to slowly, let's be clear, phase out phrase and exact. Phrase out. So I
Phrase
think
for sure. Get
phrase-
phrase out of here.
so. I think we have to embrace the future. Unfortunately, some of our colleagues are living in the past. But as Brandon says, you know, with the right negative strategy, broad is a perfectly acceptable way to scale your campaigns, to find people who might not be typing in the exact things that you're bidding on, but that are relevant auctions where you can help them. You can connect them with care, and you can help deliver great healthcare outcomes for them.
Alex, final words?
Yeah, so I'm going to take that 15% stat and kind of throw it back at you there, because I think that is a double-edged sword, because maybe for every new query that Google's finding that is actually relevant to what you're targeting, there's also going to be 10 more queries that have nothing to do with it, because there's just so much more different ways people are searching now. So it's really like this never-ending whack-a-mole game of negative keywords, where I can add 1,000 negative keywords, but next week Google will find a million more queries for me to bid on or to show up on, and then I have to go get those negative. So I think in theory it sounds nice, but when you actually do it, the negative keyword management gets to be a bit unmanageable.
If you want
Brandon,
to
let's
be
hear
a dinosaur, be my guest. Ultimately, though,
the Alexsaurus.
absolutely, the Alexsaurus. Ultimately, though, if you have the right signals and the right conversion signals, we have to understand the opportunity that's there, because there are other ways to get to quality besides purely keywords.
And I know I forced these guys to take the no position, but I know here at Cardinal, we are definitely of the mindset of testing into broad. I know Alex has done it pretty extensively. I forced him to take the opposite of his own point of view on it. So Alex, I don't know if you have any final words on testing into broad match and what you've seen, but I think we would encourage everybody to try.
I love broad match so much.
I knew you were a believer. We knew you were a believer.
No, I think what Brandon was saying, yeah, like the signals, if everything is grounded in the conversion signals, so it can be a really beneficial strategy for scaling, or even just finding more efficiency when you have the right signal and you're telling Google this is actually a patient, not just someone who submitted a form.
Yeah, absolutely. I think you've summed it up perfectly. Two more questions coming at us to wrap up our debate. So this is a good one. We're constantly looking at our conversion signals in the account, and the tendency is to want to get the signal most closely tied to the outcome. So something like a patient in the seat, right? But when you do that, you have fewer of those than you do of some of the signals that come before it, like a booked appointment, like a call from a new patient with the intention of booking, like a form submission. What is kind of the right scale there on how much volume of conversion you need to be passing into the algorithm versus really going after quality? So let's make some arguments here for why perhaps volume is important to running an efficient and effective paid media campaign. And then I want to hear from you guys how maybe sacrificing some of the volume for quality can really be a game changer. And I can't even remember where I started last time. So Evan, going to you.
So yeah, I guess we would argue that the more volume, the better. When you're using smart bidding, the system, if you only have a handful of conversions in the past month, it doesn't know what to do. It just gets lost, right? I mean, that'll stop spending. It'll stop being able to figure out who to pick out of the whole universe of searches, who's the best one, and ultimately stalls the system. We see time and time again when we work with clients that have daily budgets that are below the cost of an expected conversion. So let's say your daily budget is $100. The conversion cost you expect is $300. The system is just going to throw its hand up and not really do much of anything. So we would argue that the higher volume of conversions you get, even if they're not all the deepest quality, helps the system better understand what it's going after, deliver more and more of that volume at a cheaper rate, and ultimately deliver, your qualified leads, because you got them cheaper at the top. You're going to get the qualified ones cheaper on the back end.
Brandon?
Have we talked about wasted spend yet? Because this is a prime example, right?
Yeah.
The number one way that you're going to go waste dollars is by driving a bunch of potentially useless leads, right? It's great to say you want to drive huge volume of clicks or calls or something, but that does not at all necessarily translate to real new patient bookings or something that's deeper. So quality is incredibly important. We have to be able to nail that down and get to a position of quality so that we can do all the other things that we just talked about. None of that other stuff with PMAX and broad match or any of those things make any sense without quality conversions. I mean,
Brandon, like quality, how do you define it? Like what to you is kind of the depth?
yeah, what is your real end result here that you're looking to get to? We can take and make conversion signals that are as close as possible to that point. So again, if that's a new patient booking, for example, we need to be measuring a quality conversion that's aligned with that rather than a simple click or maybe an initial call. I've seen examples where we actually tried to drive huge volume and tested these things side by side. And it's honestly driven a lower cost per lead, but half of the number of eventual bookings that come from something. So you're willing to pay more for those leads if they're really good and end up aligning with your end result.
Yeah, I think the method just tends to be, we say, drown the front office in calls and they'll figure it out. We'll get it sorted out.
A little facetious there, Evan. Alex, I mean, we've tested this and we've seen the opposite happen of where you've gone so far down the quality that you totally throttled performance. What's the danger there?
Yeah, I was gonna say, like, I think quality is important, but you can't have quality. You can't even talk about quality without quantity in the first place. So you have to get the leads in the door to start with. Yeah, exactly what you said. We've seen situations where in theory, we're going down to the deepest signal we can, and it makes sense on paper. But then when you just think about how the algorithm works and machine learning models, it needs data. So we actually got less quantity, less quality actually by trying to get more quality. So it's sometimes this counterintuitive, like the more you try to get it, the harder it is to grasp.
There's not enough of it to know what you're getting.
Correct. So it's just that balance of like going down, like Brandon was saying, like going down that funnel as deep as possible to get as close as possible to that actual outcome that you want, while also being cognizant of the volume at each stage. So you can't just get as close as possible when you only get, like Evan was saying, like 3 per month, on a campaign. It just won't know how to learn off of that.
Rich, get 1 minute to make your argument. We're gonna get into our final question here.
Firstly, I'm not surprised that my colleagues over to the left-hand side of the couch are addicted to vanity metrics. Boost their egos, make them feel good about themselves.
Of course.
Nice big numbers on your reports, boys, I am sure.
Yeah.
That being said, the number one most critical thing in a Google Ads account is quality conversion signals, because Google is very good at getting you exactly what you ask for. And if my friends over on this side of the couch cannot drive enough of those, then I would query, do you have the right structure? Are you leveraging shared budgets appropriately, boys?
No.
Or are you have an overly segmented and antiquated approach to PPC that is preventing you from tracking anything other than the most shallow of actions that, quite frankly, is going to end up in misery and despair for your clients?
Oh, you heard it here, people. All right, so here's what I'm gonna ask as we're going into our final. I have team 1 here. That is Evan and Alex. I have team two here. That is Rich and Brandon. We're gonna go a few minutes over because we can, and it's the lunch break. Put into the chat, give me a number. I'm looking at the screen as these guys are debating the final topic. I just want to kind of see everybody's opinions here. Who won our debates today? I'm gonna give you guys the final prompt. I'm gonna ask one of you to give the answer for your team so we can get through this. All right, final topic. Multi-touch attribution or media mix modeling. Rich, of course, I'm going to give you the MMM because you're the expert here. I want you guys to make the argument for kind of why multi-touch attribution is going to give you kind of the best picture of what's happening in your marketing function, and you guys to make the argument for why media mix modeling is going to help you make the best investment decisions. So let's start over here. One of you take this answer for me.
Yeah. So I think multi-touch attribution is ultimately what you're going to want to be looking for, just because it's much more tied to actual interactions with your brand and your website that you can track. Like with multi-touch attribution, it is essentially predicated on being able to see click path and website visits and understand the order of those visits and how to assign credit to each one. When you get into media mix modeling, it's more around impressions and media spend and the reliance of you telling it the right environmental factors that it needs to understand why fluctuations in revenue might be due to other factors other than the media spend. So I think from a multi-touch attribution perspective, it's more tangible and gets down to the kind of brass tacks, versus MMM, I think, is a bit more nebulous and harder to grasp for people.
Rich, I have no doubt you're going to be speaking for Team 2 over here.
Indeed, it's really my pleasure. Multi-touch attribution, an absolute pipe dream. If you're willing to or wanting to invest across multiple channels, and we've already heard from our colleagues across the couch, they don't want to do that. They don't want to be on paid social. They just want to exist in the same platform. I think multi-touch attribution is fine for someone just running a single channel and being lazy. But for people like Brandon and I, who like to have complex channel mixes using multiple platforms, demand-side platforms, paid social, organic, paid search, multi-touch attribution is just too difficult. You can't do it. How do you track a paid social impression view? How do you track a audio listen? How do you track all of these things in a holistic manner using multi-touch attribution? I hope you've got 750,000 data scientists on your team that's going to allow you to do that. Your company's probably gone bankrupt hiring all those people though. Media mix modeling, very easy to get started. Takes a week or two. All you need is 22 months of historic revenue, 22 months of spend data by channel and tactic, and then you're getting a modeled approach on the optimal media investment to achieve your end business goals. And you're getting buy-in from all of your stakeholders internally, and you look like a complete rock star. So MMM for the win all day.
Well, you heard it here on the season finale, the reunion of Love is Blind. Thank you guys for participating in our poll. I have to say, the impassioned speech that Rich just gave us there at the end almost swayed me. However, I'm seeing the poll results. I think I have to call a winner a winner.
Whoopsie.
We're going to give our Scaling Up Stanley tumblers, which you guys can also earn some prizes by joining our trick or treat sessions that are going to be happening during lunch. Get into the expo. You can go back to the lobby, join the expo, look for the aliens hidden in each of the booths, collect them, and you guys can win prizes. We're giving away our coffee machine, and everybody who participates is going to get $15 gift cards. So y'all are the winners.
Thank you.
I don't like-
Surprising, but yeah.
Didn't know how many of your family were watching this.
See you guys after lunch.